store. We have two major medical headlines that we're following for you this morning. That's why we're going to bring in Dr. Jen Ashton here. One about a possible lymphoma vaccine showing great promise. Another new breast cancer screening guidelines. And Dr. Jen, let's start with that first one right there, because the debate, again, about how often.
Absolutely. Controversy continues. This one isn't about what age to start, but as you said, how often. And these new guidelines come from the American College of Physicians. They are for average risk women. That is the important word, average. And they state that starting at age 50 to age 74, these women really could be screened every other year. How does this differ from other organizations? ACOG, which is my society, OBGYNs say every year or every other year. American Cancer Society says every year starting at age 45. So again, this is going to just muddy the waters. Women are going to be talking about this at my office today and their respective offices.
It's so confusing. Yeah. Okay, you will be talking about it when you see your patients. What's the key point here?
The key is the word average. So the point is that when you talk about average risk, 80% of women diagnosed with breast cancer were considered at average risk before they were diagnosed. So that is a problem. The other thing is that mammograms since 1990 have shown that they reduce the death of breast cancer by 40%. It is not a perfect test, Robin, but it is the best we have right now. So what are the risks? Cost to the healthcare system, false positives, you know this well. It might show something that's not cancer that then might generate biopsies. But again, this is just, there's not even consensus and agreement amongst professional organizations really, but all do state this should be patient, physician-centered decision making, and that this should be individual.
What do you say to people who say, what's the harm in having a test?
Well, there are always harms, and you always have to ask yourself risk versus benefit. The harms are if you go in for a biopsy that turns out not to be cancer, there's cost, there's pain, there's potential risks involved there. So again, you always have to weigh pros and cons.
Yes, you do. The other big headline, very promising, a possible vaccine for lymphoma?
This is generating a lot of buzz in the world of oncology. It is experimental, but this is kind of a 1-2 punch for a vaccine, not to prevent cancer, but to treat incurable non-Hodgkin's lymphoma. Wow. It kind of primes the immune system, then it launches it on a seek and destroy mission against that tumor. It is also, you can see here the before and after. It's pretty impressive for non-Hodgkin's lymphoma. It is in trials also for breast, head, and neck cancer as well, so we'll be keeping an eye on it.
Very, very promising. Jen, thank you. And Dr. Ashton will be answering your questions on Facebook Live. Go there. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.